Hello and welcome to Facebook Live on, when is today? I think it's the first day of December. Yes, I know it is now that I think about it. So welcome, thanks for joining me. Today is a Growing Healthy series Facebook Live, and so I am functioning as Sherry DeWalt, and on behalf of Sherry, I have a few things I wanted just to mention before we have our guest on. So this Growing Healthy series is sponsored by our CGH Health Foundation. And if you aren't able to watch this, we do repost this on Facebook Live, and it's on YouTube that you can watch it. And the CGH Foundation's annual campaign is underway. So just so you're aware of that, you could find that if you go to their Facebook page or on our website at CGH and look at what the foundation does. There are like 17 programs that the foundation is involved with. A couple of the most recent ones are regarding dementia. I think you may have seen some billboards around town and some work that we're doing to help to educate the public and put some programs in place to help patients and their families who have dementia. So I wanted to share that. But what I really want to do is get to our program today. And today, this is part 2 of a program that started, I think we did this back in June. And I had Dr. Young Song on, our urologist here at CGH. And we thought the topic was informative enough, and there's enough other things to talk about. And the feedback that we got was positive enough that we were like, hey, let's do this again. Let's have another conversation. So this is Male and Female Sexual Health Part 2, and I want to bring on Dr. Song.
Hi, how are you?
Hey, hi, Dr. Song.
Hi.
Thank you for coming back. Appreciate having you here.
Yeah.
So a disclaimer here in that we're talking, the heading said men and women's sexual health. Today, we're going to go much more heavily into women's sexual health than men's. And because of that, I'm going to be asking questions, but Young is going to be the one who's going to be directing a lot of the conversation, and I'm just going to be sitting back. And she has a lot of good thoughts and just ideas and things that I think would really be helpful to share. So just kind of want to set that up in that way. And I also wanted to set this up, and tell me if Young, if you can see this okay, but a lot of this conversation is based upon a book that is called Come As You Are. And it's a book that Young, and I've read through it as well. And it has a lot of good information. And a lot of this is some regurgitation from that book. So that's just a little plug for that book if anyone who's watching this is interested in learning more after we've had our conversation. So, Dr. Song, are you ready to talk a little bit about sexual health?
Mm-hmm.
Okay, good. First question is this. What would you say is normal when it comes to sexual functioning? And by the way, until we talk differently, these questions are regarding women's sexual functioning.
Mm-hmm. Right. So this topic is so important to talk about because I think female sexual health is not discussed. And it's a new topic for me, like I said before, and I think it's a new topic for the medical field too. There's just a lot more interesting research and a lot more interesting topics to talk about. So women's and men's sexual health are actually different. So the way that you typically think of sexual desires, they all seem to be more like male-centered in terms of what the media gives us, and so I think having a separate discussion about women is really important to have that complement because that's how we'll work better together. So when you said what is normal, and I think that people really want to know, like what they really seek out, what is normal. They really want to know, and that's why. Like all those articles and like women's magazines, like men's magazines, like just like all those, if you ever get any like ads, it'll talk about what's the latest like new way to have an orgasm, or what's the latest, what's the best top 10 like secrets of sex. And I feel like people are drawn to that because they want to know like what is normal. But I actually want to say that right off the bat, like there's no real normal. And that's, I think that's hard for people to like, oh, because I think after the end of our conversation, people should feel like I am normal just the way I am. And I'm normal with like the current, like the, you know, my desires or my arousal state, my sexual performance. Like that should just, people should hopefully at the end of this talk will feel like, hey, the way I am is normal. And I don't have to be judged by another standard, you know, what society says is normal. Of course, there's like specifics to that. And I think that like because there's so much variation between female to female, that maybe like my normal is maybe not a little different than another female's normal. And so there is a lot of variation. So when you say like what is normal, that's already implying that there is a normal. And I think this is the conversation to free you from that thought. So
Yeah. And speaking of maybe some freeing from thoughts, the next question just wanted to ask was kind of along those lines. What role does non-judging have in sexual functioning? And for instance, a woman's feelings.
Okay, so non-judging is a way of interpreting your feelings and not saying whether it's good or bad. Like, you know, saying like, oh, whatever your thought is, to kind of interpret that and judge yourself and say, hey, I'm good because I did this, or I'm bad because I did this. And so if you want to go try to be more non-judging or non-judge, basically to non-judge, you want to just interpret your experience as your experience, and you interpret your thoughts as they come, and not make that extra layer of judging yourself. And so a lot of that judging, non-judging can happen because of what the messages you've heard, like the three that we talked about were like the medical message, the moral message, and the media message that we are just unconsciously absorbing, you know, since our childhood, and maybe like the way we were brought up in our family. But I did want to say that when you know, like it says like what, back to your first question, I wanted to add is that when you say like what's normal, it's like it is helpful to have research to kind of tell you like the general, like 90% of the population will do this or such and such. So I will say one of the statistics right away that I found really interesting from this book was saying how like around 10% of women have never experienced orgasm and have difficulty with orgasm. So that would be saying like, you know, like that would be saying normally most women can, but you want to also remember, like, you know, as most things are on a bell graph in terms of our health, that there are women on one side of the spectrum and then women on the other side of the spectrum. And so when you say normal, it's actually very broad. But just to know these like statistics where 10 to 15% of women can have difficulty with orgasm, and be sensitive to that and understand that. And for those women to hear like, oh, you know, I'm not alone, or I'm not, you know, there's nothing wrong with me. It's just that there's a certain population. Yes. Yeah.
And even to rehash, if I might, Young, what we talked about last time we had our conversation, what were the percentages in terms of women with what you would consider, like the media would consider traditional vaginal, you know, penile penetration, vaginal intercourse of women that works for in terms of having an orgasm?
So like the media always portrays like a woman having an orgasm in the time of intercourse when the penis is penetrating into the vagina. And so everyone knows that script, and everyone knows that what that's implying. But in actuality, like only 30% of women can actually have like reliable orgasm with penile or some vaginal penetration. And so that means like 70% of women typically like orgasm like other ways. And so when you say normal, like what the media is portraying is actually not considered, is not really normal if you think of normal as 50% or greater. And so that's a really, I think just like learning that alone is like allowing you to expand your definition of normal. And so like the book will say something like, you know, women have orgasmed all different kinds of ways. And really the orgasm happens in your brain. Even though, you know, you're experiencing it in your genitals, like if your brain is really relaxed and turned on and in a comfortable situation, you may be able to let yourself go and have an orgasm. I mean, she had some interesting examples, like, you know, your feet getting massaged, or I'm not sure. There's just a ton of examples. But basically, you can't reliably have an orgasm with just vaginal penetration. And the fact that the media, like over and over again, like stresses that is just not helpful for female sexual health, nor is it helpful for a male. Because a male is thinking like, well, you know, if he even knows if she's having an orgasm, like will think like, oh, this is the way to have an orgasm with a female. But in actuality, like your partner may not ever get that.
Yeah. Yeah, good point. And so I'm going to kind of talk a little bit more about some media messaging, and I want to move on to desire.
Yes.
So, yeah, you watch a movie and it appears that a lot of in those shows, the woman will have the spontaneous desire for the male lead or whoever in the movie or whatever. So can you kind of talk a little bit about this idea of spontaneous desire versus responsive desire? You know?
Yeah, and I think like having a language to describe what we know and what we experience is very helpful to communicate between two partners. So spontaneous is what you normally see on TV, where all of a sudden you just like see the partner and you just want to take your clothes off and like, you know, you guys jump into bed. I mean, that's kind of like, you know, you're in the middle of like, I don't know, doing something. Maybe you're paying your bills and all of a sudden like you just feel that desire. But then
that hasn't been my experience, you know, with my wife for some reason.
So, I mean, I think that you can have like that, you know, when you're like dating, like usually like that kind of thing is more when you're like, you know, maybe when you're younger or dating, that kind of thing. But like in real life, like most women are actually more have responsive desire, meaning like they'll respond to their partner's either gestures or actions or kind words, like, you know, acts of service, thoughtfulness, kindness, feeling, you know, in a relaxed state, like their context, like the location they're at. Maybe, you know, maybe like the desire is not going to be there when she's at her house because her house is messy and her kids are there and she's just not going to have that. But maybe, you know, the partner takes her away on a nice romantic vacation and you set the context and you've set a different environment for her to have more of that responsive desire. And then I think that goes into like talking about another topic that we may have mentioned in the last talk was like brakes and accelerators.
Yeah.
So, well, actually, to finish that, spontaneous desire is more like generally like males have more spontaneous desire. Maybe they just like see like a woman in a bra and they're like, wow, I'm really turned on. But maybe like a female, like sure, she sees a guy and maybe she doesn't have that spontaneous. But for females, it's more like, wow, he did the dishes for me. And now like the laundry's folded and now I don't have to worry about it. And wow, now I'm free, like to have desire fill my mind. So that's kind of the difference. I always use the dishes.
That's all right. That's all right. You know what? It's a common thing in life. Dishes happen. All have to happen all the time, right? So
every day. Maybe vacuuming is your thing. I'm not sure. So all women have their own set of desire, like of brakes and accelerators. So like acceleration meaning like wanting more desire, brakes meaning like let's not have sexual desire right now. So generally another stereotype is like men have more accelerators and less brakes and women have more brakes and less accelerators. So advice for men and women are that if you have a lot of brakes in your mind and you know what those brakes are for you, then you can slowly try to take one of those brakes away. Like one of the examples is, let's say your kids are at home and you don't want to have sex because you think like your kid is going to walk in on you. maybe you guys need to set some time when the kids are not at home, something like that, like taking away a physical break in your mind. And so I just say that there's a lot of variation between women to women, because maybe my breaks are not the same as, Joanne's breaks, someone else. So, and then of course, the accelerators are things that help you to be more, in the mood for sexual activity with your partner. So finding out what those accelerators are also really helpful to discover between yourself and your partner.
Right. So we were talking about spontaneous versus responsive desire. Let's talk a little about desire itself. How do you know if you're someone who tends towards low or high desire, Jan?
So low desire and high desire, that also implies, like right there, like, is there something wrong? Is there something wrong with the person with low desire? And first we should just say, no, there's not, because it's actually relative. Like, let's say, you're dating person A and they have like very high desire. I mean, let's say you're just a normal person. You think you're a normal person, and then this person that you're dating has a really high amount of desire. Then you're considered like a low desire person in that relationship. But let's say then you date somebody else and this person has even lower desire than you, but your desires never changed, then you're considered the higher desire. So I think it's relative to your partner, in terms of low desire. But generally, if you want to quantify it, it's somebody who has more breaks than accelerators, like a ton of breaks like going on versus like very little acceleration. Yeah. So that person may tend towards more like low desire.
Sure. Mm-hmm. Good. I want to talk about a concept called that's going to be, I think most folks will not know what this is, so that's why we're here. A concept called criteria velocity. And it kind of has it relates to realistic expectations in something like sexual functioning for a woman. And the example maybe that you could kind of talk about is when the woman wants to have a baby. Can you talk a little bit about that, Jan?
Yeah, the criterion velocity goes with actually two other things. Is number one, her goal. Oh, excuse me.
Well, Young's day job is pulling her back in. Go ahead.
Hold on.
Says she's had a busy week with patients.
That one actually can wait.
Okay.
It's okay. Anyways, so the first is goal, like what your goal is, and is it realistic? Number two is your effort. Like how much effort do you think this is gonna take? And the last one was criterion velocity. Is like, how long is this going to take me to do? And so your example, did you say the example about the woman expecting to have, so like a couple will try to have a baby, and then maybe she thinks, oh, this is going to happen in like 3 months or 6 months. But in actuality, most couples have to try about like a year before they actually conceive, or, it depends, like shorter or longer, depending on how fertile the couple is together. So her criterion velocity is like, oh, I should have done this, and I should have had this baby, or I should have been pregnant in 3 to 6 months, and thinking, and then by the time like the ninth month rolls around, she's very upset. She's very like unhappy. She like this is becoming like a source of anxiety or a source of like concern for her and her partner probably. So that criterion velocity is your own like expectation of how long this should take me. And so when you have expectations that are maybe unrealistic or unbased on like science or just what you see on the magazines, you may be upset. You may be unhappy because of that incorrect criterion velocity.
Yeah.
So that was all in reference to actually it was a chapter in the orgasm, and this chapter on orgasm was like talking about. Remember, I said there was like about 10% of women that have difficulty or have never achieved an orgasm, and so like when you have a goal, like your goal is, I just want to have that amazing orgasm, and you think in your mind, like if you watch porno, I don't know if you do, but apparently in porno, like the female has orgasms often and very easily, but that's not in reality. That's like totally as like a fantasy, right? Mm-hmm. So you actually don't realize that, hey, there's, you have this goal of orgasm, you have this thing like where you think, oh, this shouldn't take me that long, or it shouldn't take me an hour, or it shouldn't do da da da, and then you think it should be, a certain amount of velocity. So
Sure.
that was kind of in the reference of like how, you can use that. But
yeah. Next concept I want to ask you about is sexual scripting, and
okay.
how that plays into sexual functioning. You want to talk about that a little bit?
Yeah, so I looked into it a little bit, and it actually came out in the mid 70s. I think like 3 sociologists talked about social scripting, and then like specifically sexual scripting.
Okay.
And basically any kind of social scripting, it is basically a source of like how we're enculturated and how we know what to do when we're in a certain situation. So if you and I are from the same social script, then we know what our roles are going to be together. But if we're from 2 different scripts, we may not be able to, get along well. So sexual scripting is all the things that we have in our minds that we don't even realize, like we don't question. We think this is just how it is. And so one of the examples was a female who's only watched porno and thinks that there's a certain way that a female should act or a female should be, but yet she has her first sexual experience and it's nothing like what she expected or nothing like what the porno was like. So her script is completely off, wrong. Like, no, there's nothing wrong with her. It's just her scripting isn't going to match reality. So I feel like if you have a script in your mind that is not helpful or is not true, then you need to change. You can rewrite your script. And so that's like trying to bring awareness to what your script really is, like what your personal script is, and and how you want to rewrite it. So it's not just like aware. Well, actually, first is awareness of like what you have in your mind, and then it's the non-judge. You have to bring in the non-judge, where you don't say you're good or bad, or you just kind of let the experience be itself. Yeah.
Okay.
We answered that.
A lot of concepts that are new to, I'm sure, to folks. Here's another one. Okay. So, let's talk about, let's you talk about meta-emotions and how do they fit into a woman's sexual experience? Yeah.
Yes, the meta-emotions was a new concept to me as well, but the term meta has been around since the Greeks, and so meta means beyond. And so it's a reflection on yourself. And so when you have a meta emotion, you have your primary emotion, but then you have a secondary emotion on top of that. And I'll give you an example. The example that was online is like something about like you felt, very sad. Let's say you feel very sad because you can't see your parents during this pandemic, right? That was already a couple of years ago. But let's say you were isolated, you couldn't see your parents, and you felt bad, or you felt like sad. But then after you felt sad, you felt kind of guilty. You're like, oh, I feel kind of bad that I'm feeling sad because, other parents have died. At least my parents haven't died, or something like that. So you're kind of putting that value, or you're putting that extra emotion on top of your first base emotion. And so sometimes meta emotions are good. Like you could have a positive experience and then feel positive again on top of that. Or you can have a positive experience and you can have a negative emotion on top of that. And so when we talk about sexual health and we think about like when it's unhealthy, there's like feelings like shame and like being afraid or being judging. Those things are kind of the dark side of how someone feels unhealthy. And so the meta emotions that can go on top of that is where you can become unhealthy in terms of like your thinking. So I actually have this great quote from the book. It's how you're feeling about your feelings, basically. And that influences your sexual function the most. So if you think you're doing well and your sexual function is great and normal, your sexual being will be very like positive. But if you judge yourself and you think, hey, I'm not normal, this is, I wish I was this way, or I should be this way, then you can have, be very unhappy with your sexual health.
Good. So let's go to a question about orgasms themselves. And so here's what I wanted to throw out at you as a question. So what do we need, what do our viewers need to know about a woman's orgasms versus like a woman's pleasure in sexual functioning, Young?
Right. Okay. So that was also a very good concept. Because I think most people focus on getting an orgasm, or maybe that's like, the end goal. And you feel like that's what we're working up to.
Maybe that's the societal scripting, or whatever you want to say.
Yes. You feel like, hey, we didn't do anything until like, this has happened. And so that's like, yes, that's exactly a script right there.
Okay.
And so to change that script, you actually, and then like, especially if you're chasing after an orgasm. So the book is talking about orgasm. And so you're like reading the chapter and you're trying to wait, like, okay, what's the secret? What's the big punchline? So basically the punchline is like not focusing on getting an orgasm and really just focusing on getting pleasure. Because once you focus on pleasure, like the pressure of getting an orgasm is off. And then you can finally relax, and then you can finally let go, because that's until you let yourself like go, the orgasm may never just like arrive. And then it talked about like, some women, like they did these exercise, they did like these, they tried to, basically a couple tried to not have an orgasm. Their goal was, hey, let's do everything we can, but not have an orgasm. So basically like that pressure was gone. And so then they like built up to it multiple times. And then finally, when they did like have an orgasm, she had like, the best orgasm ever. Right. So it's kind of like when you don't focus on it and you kind of take away that pressure of having that, you've already achieved your goal if you and your partner are having pleasure together and being able to provide intimacy and comfort and joy and like pleasure together. So if you just focus on, that feels good when he like rubs my shoulder, you don't have to worry about like, oh gosh, is this going to lead to an orgasm, and how long is this going to take, and how much effort is this going to take, and is it going to happen fast enough, that kind of thing. Like those things all kind of kill the desire, kill the mood. And so not everyone has a whole hour just to hang out and fool around, because we're all kind of all busy. But that's kind of what she's saying it takes. You need, if you really want to really develop that great orgasm ability, you really need that time and space to create that for yourself, you and your partner. So when you just take away the goal of orgasm and you just focus on pleasure, then a lot of things can happen from there.
You and I, before we went on the air, Young, we were talking about just some of the themes that we were talking about, and they do tend to kind of flow into each other. Mm-hmm. In that it sounds like as you're talking about this and as you read the book, there are so many things that are just more about just not judging yourself, being okay with things, not rushing. All those kind of themes seem to be a big component as I have read and as you're talking today.
Mm-hmm.
So.
Well, so that book was called Come As You Are.
Yeah.
Okay.
Oh yeah. And I'll show it again because we want to give the author a plug.
Yeah, Emily
Nagoski is the name of the author.
Yes. Yeah. And it's amazing. She's been doing this work for I think 20 years. But even the word "come as you are," you're thinking, okay, come, like you're thinking, like you're focusing on orgasm. But in actuality, like once you finish the book, it's really be who you are and be like yourself. Like, as long as like that actually is more important than anything, because when you talk about like normal and like every couple is so different. Every couple has their own problems. Every couple has their own like strengths. And so every couple has their own taste. You know, some people like spicy food and some people like sweet foods. I mean, like, you know, there's just so much variety between couples that you really need to seek out what is most pleasurable between you and your partner. Mhm.
Yeah, and I want to talk just a couple partner questions before we
Okay.
close things out. So, what role do men play in allowing their experience and their partner's sexual experience to be a positive one?
Yes, I think the if you're in a heterosexual relationship, that male partner is I think is like make it or break it kind of situation. You know, if
No,
yes.
I'm feeling pressure, Young.
Well, I know I don't want to give you a sexual script that's not helpful. But okay, so there were the 3 P's. She basically talked about patience, practice, and having a like safe, positive context, or I'm sorry, sex positive context. Okay, so I think your partner, you definitely need patience. Like, I mean, I have a lot of erectile dysfunction patients and that we treat.
Yeah.
And like some of those treatment options after medications, you've got the vacuum device and you've got penile injections. And I mean, that takes a lot of patience. You know, you have to have a partner to have patience with you. You know, if your thing is, you know, I can't orgasm right away, you need your partner to help, like, know that your partner will give you as much time as you need. So that's like patience. And then practice is always good. Practice makes better. So it's not going to work the first time. Like, especially like when men like try Viagra the first time, maybe it doesn't work. Maybe you just need more practice, or, you know. So yes, in the female context too, like you need more practice, maybe practicing letting go, or practicing non-judge, practicing relaxing, like practicing like what body parts are more pleasurable. And then you need a sex, keep saying safe, sex positive context. So if you have a lot of meta emotions that are like shame and like guilt, like that is not a sex positive context. So if you can change the script, you know, change the meta emotions, or at least non-judge, like realize,
Mhm.
oh, like these are things that are going on, then you can hopefully create a more positive context. So, and if your partner can understand these concepts with you, I think that would bode really well for the 2 of them together.
Yeah. One final question for you, because obviously you're a practicing urologist. You see patients all the time with sexual function issues.
Mm-hmm.
Any common themes or thoughts you'd want to leave um, the folks that are listening with about as regards to what you see in your patients?
I think that I see a lot of men. Sometimes I see them with their wives or their partners, but I do think it's definitely a discussion that both partners need to have together. And I think like the brakes and the accelerators are very useful information. Like, you know, if I'm not a marriage counselor at all, I'm not a sex therapist at all. Like, I'm just a urologist. So if you need to see a sex therapist or a marriage counselor, I think that's a very good idea. But just like kind of reflecting on the brakes and the accelerators between a couple, that would be great to communicate. You know, like, hey, like, and if typically like the husband's like, oh, I wish I had more sex with my wife. That's typically the concept. But I'm thinking, well, you know, maybe your wife can tell you what can give you more sex at home. Like, maybe you really need to do the dishes. Maybe, you know, maybe that's kind of like, I think like if the couple can have more dialogue about not just the problem is, you know, I'm not having enough sex. That is like actually not the, you know, and to even like make it like that is kind of difficult. It's not really like a turn on to think of it like that. So I think, well, where are we and where do we want to be? And if someone is considered high desire in the relationship and low desire, you kind of want to like try to come to the middle, like if you can. There's nothing wrong with the high desire person, and there's nothing wrong with the low desire person. It's just where they are. And I think because I see patients in different decades in their life, you will hear that, you know, they were not really they didn't have high desire in their 40s, but all of a sudden in their 50s they have high desire, or just like reverse. Maybe they're 60. I mean, I have high desire people in all ages, like 70, 80 even. So, it all is like, it can ebb and flow too, even for like a female, especially too. So I think that's important to make sure that there's no problem. It's just kind of like the situation that you should just work with and have like realistic expectations, like nobody's 20 anymore, when nobody's 20 in my clinic when they're talking about ED anymore. So you're not going to be like how you were when you were 20. So let's just kind of change the goal so that you are not disappointed every time. I think it's better to have a realistic expectation of what will give you the most pleasure, and not the extra judging, and not the extra negative emotions, or even the pressure of trying to have a great time. Yes.
I almost hear you talking. It almost sounds a lot like it's not so much about the result; it's about the process.
Yes.
That is more important to focus on, if you will.
Mm-hmm.
Yeah.
Yes, I think that's great.
Okay. Well, hey, you know what? This is it's in many ways it's not an easy topic to talk about. So I really appreciate you, Dr. Song, to take the time to talk about these things. You and I have, when so it's not easy to talk about, and yet it's, life. That's one of the things in life that it happens, and it's a good thing, and it's something that it's part of our health.
Mm-hmm.
So I'm so glad that we've had a chance to have this conversation, and have a couple of them actually. Who knows? Maybe there'll be a part 3 at some point in time. But I sure thank you for doing part 1 and part 2, and for being willing to share this, because it's good stuff, and it's information that people don't typically hear.
Mm-hmm.
So I feel really good that at CGH, this is one of the things that we talk about when we talk about health as well. And I appreciate you and taking the time to come on, and really appreciate all you do at CGH for our patients and this too.
Well, I thank you so much. I appreciate this opportunity. And yes, I think it's a topic that will grow in interest. And she does have something on Netflix as well. I didn't see it myself, but it's a lot of the concepts we talked about. She has it in like video, like on media, television media, healthy television media. So, but thank you so much, Dr. Bird, for this opportunity. Thank you for your time too. So,
all right. Thank you, Dr. Song. Hope you have a good rest of your day.
Yes. Happy holidays. Bye.
Thanks. Okay. So what I'm going to do now is I'm going to transition to a couple of things. The first thing I'm going to do is just talk a little bit about respiratory illness, because there's still quite a bit of that right now going on in our community, in our communities that we serve. But still, COVID is still going pretty strong, and actually seen a bit of an uptick of that lately. And you probably have read that the newer strains are becoming more prevalent to the point where just yesterday the CDC sent something out and said that one of the monoclonal antibody therapies that we've been giving at CGH, I'm going to butcher the name, but it's like bevlotovimab is the name of that monoclonal antibody. They just said, you know what, it's not working anymore. So we're stopping, as of yesterday, giving that for intravenous therapy. The Paxlovid, which is still available and is still thought to be helpful for even the newer variants, is still an option for doctors and nurse practitioners, PAs, to give to their patients. But the antibodies, the intravenous antibodies, are no longer a fit. And I don't know. My guess is that some drug companies are probably working on other options, but right now we don't have monoclonal antibody options for patients. So that's pretty new. The other thing that we're at the hospital thinking through is right now our masking policy has been when a provider goes in to see a patient that we ask that they wear a mask. We've just kind of said now, with some new information with what's going on in the community with that, we're rethinking whether we may go back to a more wear your mask all the time policy. I would anticipate sometime in the next week or so that there may be some changes in that. But for right now, we're at where we're at. But just want to kind of give like, hey, this might be changing so the public is aware of that. And yeah, we're seeing a lot of RSV, which primarily affects little kids in terms of getting sicker with RSV. For most adults, that causes just a bad cold. And also, we're beginning to see influenza. Patients are being hospitalized for influenza right now as well. So, influenza and COVID have immunizations, vaccines that you can get for those. If you haven't gotten the most recent COVID vaccine and you're a candidate for that, I strongly encourage you to get that. And if you haven't gotten your flu vaccine yet, I strongly encourage you to get that as well. Okay, that's respiratory illness stuff that I wanted to talk about. And then finally, I wanted to give some updates, shout outs, information for the community. So first of all, as of this upcoming Monday, we're doing a winter clothing drive for CGH main clinic, and there'll be some information we'll be posting about other offsite areas at CGH, other offsite clinics, where you can either drop off a gently used or new coat for folks to wear, or you can pick one up if you need one. So more to come on that, but coming as of Monday, we're going to have that as an option for our community. And I want to give a shout out. My eyes are terrible here, but Brenda Holdorf, yes, is retiring after 29 years. I couldn't read how many years that was, working in the operating room. So congratulations to Brenda, and wish her the very best in her retirement. And next December 20, it's upcoming December 22nd, we're going to re-show our holiday lighting ceremony that we did online. That'll be December 22nd, and I'll pop on for some information about respiratory stuff and any other new items that we need to talk about. We'll talk about that December 22nd for our Facebook Live. And I want to wish all of you a Merry Christmas and a Happy New Year. I will be also coming on in sometime in January, and we're going to have one of our OBGYN staff to talk about issues related to that. I think we're kind of be leaning more in the direction of gynecological issues, and that's most likely going to be our theme in January. I think that's all we wanted to talk about. Yep, here I'm back on. So the marketing staff, if there were more things that they'd have to show for us. So I want to thank you for taking the time to watch this broadcast. And if you found it informative or helpful, surely would encourage you to share that with your friends and family. So until next time, thank you for taking the time to listen, and we'll see you soon.